So we're going to have the patient stand about 10 feet away from our Snellen chart, and I'm allowing the patient to use his corrective lenses so that we're able to test how he sees normally. Sir, can you read, can you cover your left eye, your hand, and read line number 8?
DEFPOTEC.
Okay, can you cover the other eye and read line number 8?
DEFPOTEC.
Perfect. Okay, you can have a seat. Again, we'll continue to examine your eyes. Since the patient was able to read line number 8 on my Snellen chart, that is suggestive of 20/20 vision. Sir, would you mind removing your glasses?
Oh, no, I don't mind at all.
So I'm going to examine his eye. I'll examine the external eye. I'll look at his the actual eye itself. Sir, can you open your eyes wide for me? We're looking at the sclera. It's white. There's no sign of any hemorrhage or lesions on his actual eye. Let me take a look at this one as well. That looks normal. And then I'm going to look at his the actual iris and pupil of his eye, which are normal circles, perfect round circles. They're not irregular shaped. There's no glaze over his eyes that would be suggestive of cataracts. Sir, I'm just going to dim the lights for a moment. I'm just going to check your pupil reaction with my light here, which is normal pupillary reaction. I noticed the eyelashes are curved away from the globe. Assessing his eyelids, they appear to be symmetrical, no signs of any ptosis. Sir, can you close your eyes? Close them real tight and then open them real big. Perfect. Normal movement of his eyelids. They're able to cover his eyes completely. And when I assess the conjunctiva of each eye, I don't see any sign of styes, exudates, or bleeding. Moving on to an assessment of my patient's ear. The actual ear itself on both sides, if you see, appears symmetrical and normal position, normal shape, size. There's no nodules or lesions, ulcerations on the ear. If I pull back and up to examine the inner aspect of the ear, you can see the tympanic membrane. There's a bit of cerumen, but the tympanic membrane should appear pearl gray. It looks clear. There doesn't seem to be any lesions, ulcerations, or bleeding. I'll just check your other ear, sir. Looking for the same thing, which it looks normal on this side as well. Ideally, you would use an otoscope during an exam. Now we'll just move on. I'm just going to inspect your mouth, if that's okay. Are you able to open your mouth for me, sir? Can you stick your tongue straight out? So if you notice his tongue is straight, no sign of any deviation. I'm just going to, you can bring your tongue back in. I'm just going to take a look at open wide. So there's no sign of any dental caries, any lesions or ulcerations or abnormal growths in his mouth or tongue. Sir, can you stick your tongue out one more time for me and say ah? Okay, the uvula is centered. Does not seem to be any abnormal position. I did not use a tongue blade because I didn't want to elicit gag reflex. So, like I said before, everything appears normal with the mouth. Finally, we're just going to assess your nose. Are you able to kind of depress one of your nostrils and take a breath in while Okay. And do it on the other side. So both nares and sinuses seem to be patent. So just take a look on the inside of each nair. They appear patent. I don't see any signs of exudate, any nodules, no sign of, once I palpate, I don't feel any type of deviated septum. Sir, do you have any pain along here
No,
when
not
I
at all.
touch?
No, I don't.
The one thing that I did forget to assess with his neck was the thyroid gland, which you palpate just along the sides of the cricoid cartilage. Sir, can you swallow for me? Okay. It appears to be, or feels like it's in normal position and size. It doesn't feel enlarged. Is it tender when I touch there?
No, not at all.
Okay, perfect. That'll conclude my assessment of the head, eyes, ears, nose, and throat.